like we typically do and give an enrollment update where we are. And then the bulk of the meeting today will be going through our rule revisions to align regulation with our waivers and first choice, which we have informally started calling our CFC rule cleanup. These rules are not at all tied to sustainability initiatives. They are separate, and a lot of the pieces in those rules are technical cleanup, but my team member, Maddie Quattaro, who is really our regulatory SME, will be taking you through those changes today. So that'll be the bulk of our meeting. And then the final bit of our meeting will be to go over our update for the emergency rules that are related to a few of the CFC sustainability initiatives. And then we'll have open forum. And so I'll just say right out of the gate, if you do have questions about sustainability initiatives, please hold those until the end. We're only going to be taking those questions at the very end of the meeting. And I'll state this later in the presentation. If you have detailed operational questions about those initiatives, please attend your case manager. Please attend those CMA office hours for sustainability initiatives. That's really where the appropriate SMEs are on, so they can answer those questions. Okay, with that, we'll get started. Just as a reminder, this meeting is always recorded, so please do not share any protected health information. If protected health information is shared, it makes it difficult for us to post these meetings online, and we always post them online on our stakeholder website. So please refrain from sharing any health information on this call. And then if you need any accommodations for this call, such as translation services, please don't hesitate to reach out to our civil rights officer. Their email is HCPF, HCPF 504ada@state.co.us, and we ask that you give us at least 1 week prior to our meeting to help get those arrangements in order. Alrighty. So if you are new to this meeting and new to Community First Choice, I'll just give a brief overview before we dive into things. So Community First Choice, or CFC for short, is an optional state plan program that states can choose to implement. It allows us to move a certain set for HCBS, our home and community-based services waiver services, from those programs to Community First Choice, where it lives under the state plan. And so those services, which are on the left-hand side of this screen, become available to eligible members regardless of the waiver program that they're on, and to eligible members on the state plan. So the services we brought over when we launched CFC on July 1st of 2025 include homemaker, personal care, health maintenance activities, remote supports, home delivered meals, transition setup, personal emergency response system, and medication reminders. And then our 2 participant-directed service delivery models in Colorado, in-home support services, or IHSS, and consumer-directed attended support services, or CDOS. So again, regardless of the waiver program that you're on, you can now access the services on inside of this screen. And if you are on the state plan and you need an institutional level of care, if you're on Medicaid, need long-term care, you can also get these services even if you're not on a waiver. So we've expanded access, and again, we launched in July of 2025. So we're coming up on we're coming up on the end of our first year, which is exciting. So with that, I'll just give a brief update on our enrollment. So currently we have a little over 23,000 members enrolled in the program, which is great. We're on track for all members to be enrolled by the end of our transition year, which will be July 1st of 2026. And we have almost 900 CFC only members. So members who are just enrolled in CFC, also a waiver program. And then for those of you who are unfamiliar with our new children's waiver program, our children with complex health needs waiver, the same time that we launched Community First Choice, we also launched a new children's waiver that merged the Children's Home and Community-Based Services waiver into the Children with Life-Limiting Illness waiver to make this new children's waiver called the Children with Complex Health Needs waiver. So all children who were on the CLLI waiver, which is short for the Children for Life-Limiting Illness waiver, were automatically transitioned into the new waiver. And then children on the CHCBS waiver, which is short for Children's Home and Community-Based Services waiver, they enroll at time of CSR throughout the year into the new waiver and CFC. So far we have a little over 1,000 children enrolled into the new waiver from CHCBS, so that enrollment is going smoothly as well. I'll make a quick plug here for any case managers on the call. As you're going through your enrollments for CFC, please make sure you are taking the necessary steps in order in the CCM, in our care and case management system, to make sure that both your HCBS and your CFC program cards are opening as they should prior to conducting your service planning with your members. It's really important that those steps are taken first and in order to ensure that those program cards and all the data is displaying as it should in the CCM. So, as you're approaching your CSRs for your final members transitioning and for your members who perhaps were that first batch to enroll into CFC July 1st, it's a really good time to just double check and make sure all of your program card information is displaying correctly. If you have any questions about that, please reach out to us. We have job aids that we can link to you if you're a case manager to make sure that you're up to date on all the proper processes. Alrighty, so with that, I will now pass it over to my colleague, Maddie Quattaro, who will take you through our CFC cleanup rules.
All right. Hello, everybody. My name is Maddie. I'm a policy advisor here at HIGPUF, and I will be walking through a proposed rule change that is, as Eileen mentioned, it's essentially, we're calling it cleanup, but we gave it a fancier title to align regulation with HCBS waivers and community first choice language and operational practice. So next slide, please. All right, so first I will go over the timeline for this rule. So we just posted the regulation, I think yesterday, and have a feedback form open. We're presenting in this meeting. We are requesting that you submit feedback by March 18th on this regulation. Our first meeting to MSB, our initial adoption is May 8th, and then final adoption will be June 12th, and then the rule will be effective on August 14th. And again, I want to note that this rule is not connected to Medicaid sustainability initiatives. It's really just cleaning up some key points of regulation that we get asked a lot of questions about, or doesn't necessarily align with current practice. So next slide, please. All right, so I'll walk through high level what you'll see in this rule. So the first big change is we are removing all references to the Children's Home and Community-Based Services waiver, as that waiver will no longer exist as of June 30th, 2026. So we're removing references to that, and then we are renaming. There were a few instances where we missed children with life-limiting illness waiver, where that was supposed to be children with complex health needs waiver. So we are fixing those issues. Second, we are cleaning up outdated consumer-directed attendant support services citations, or CDOS citations. Several rules ago, I think 2 years ago at this point, that CDOS section had received a new number from 8.7514 to 8.7515, and there were just a few points that we did not catch revising that citation. Third is renumbering the extraordinary cleaning section. I'll dive more into that later on in this presentation, but there currently are 2 sections, extraordinary cleaning and CHARP habilitation, that have the same citation, so we're fixing that. We are adding clarifications to extraordinary cleaning provider requirements, specifically family members providing the service. Next, we are clarifying some of the language in the home delivered meal section, really just restructuring it. Next slide, please. Then we are renaming the physician attestation of consumer capacity form to the physician attestation of member capacity form. That change was actually made back in July, but we did not update our regulation, the name of the form in our regulation. So we are doing that through this change. We are also adding in language to clarify that the physician attestation of member capacity form is not required for members under the age of 18, because those members are already required to have an authorized representative. Then we are clarifying the role of a transition setup coordinator. Again, not changing the role, rather just clarifying in regulation that there's a difference between transition setup coordination and transition setup expenses, which we'll go over more in depth. We are rearranging the transition setup exclusions section, and then we're also adding into that exclusion section streaming services and gift cards. And then finally, we are adding language for the requirement for CFC only members to provide verified documentation of the individual's qualifying diagnosis or medical conditions. So next slide. And I want to, before diving into the rule itself, I just want to go over just some of the high level, like bigger changes, and just talk them through before showing the rule. Again, this regulation is not intended to change any existing policies. It's really just clarifying things, clarifying the regulation, cleaning it up, and making sure that our regulation really clearly aligns with practice. So to start, we'll go through the first big change is the extraordinary cleaning section renumbering. And I want to call this one out specifically because it's a little complex what we're trying to do. So when we were looking at how to fix the issue of CHIRP habilitation and extraordinary cleaning having the same citation, we realized that there was a separate rule being proposed in April to repeal section 8.7524, which, if that rule passes, that section of rule will be kind of just open. And if that rule passes, it will happen before this rule is effective. So if that rule goes through and passes, then that section will be open. We are proposing that extraordinary cleaning takes that section. But I want to note that if that other rule does not pass or changes, and 8.7524 may not be open, we will use 8.7522-1 for extraordinary cleaning instead of 8.7524, because I want to be very clear that we are not, with this change, we are not intending to overwrite an existing section of rule. We're kind of wiggling into a potentially open section, but I'm going to be keeping a very close eye on it. And I'll also provide that MSB number. So if anybody's interested in tracking that separate rule itself, they can do that. But just know that that's where it's a little bit complicated. So next slide, please. Okay. So next, I want to talk about you'll see a new section in the rule for extraordinary cleaning. So currently our regulation does not specify whether family members or legally responsible persons can provide the extraordinary cleaning service. It is one of our most frequently asked questions. So this rule clarifies that family members or LRPs, legally responsible persons, can provide this service and outlines the requirements for this group of providers. And I want to make it very clear here that extraordinary cleaning and homemaker are not connected services. This means that the homemaker legally responsible person limit does not apply to extraordinary cleaning. And on that same note, the annual limit for extraordinary cleaning does not apply to homemaker. They are not the same service. So I just want to make that very clear. And then finally, this rule clarifies that extraordinary cleaning can happen through organized healthcare delivery system or OHCDS. Next slide, please. So I've touched on this one, and we'll touch on it a bit more in depth in a little, but for in-home support services, again, we're renaming the physician attestation of member capacity form. And since that form determines the need for an authorized representative, and members under the age of 18 are required to have an authorized representative, members under the age of 18 are not required to have that form. So this rule is just clarifying that. That is already happening in practice, and we are just aligning regulation. Next slide, please. All right, so transition setup, coordination, and coordinators. Again, we are clarifying that there is a difference between the two, and just clarifying what we mean by certain things in regulation. We're not changing requirements for transition setup coordination or transition setup coordinators. We're not changing anything about the service itself. We're just clarifying. And we are also rearranging the transition setup exclusion section and then including in the exclusions that streaming services and gift cards cannot be covered as transition setup expenses. Next slide, please. All right, and then our last kind of big change that is a little bit complicated. So at the October 2025 council meeting, we noted that there is a discrepancy between the Colorado State Plan Amendment and our regulations for CFC. So our SPA says that we require a professional medical information page or a PMNP, but our regulation does not include language around that requirement. So since that meeting, we have requested that all case management agencies obtain a PMIP to align with our SPA and also to make the level of care process more uniform and make transitions between programs easier for some members. Now, where it gets complicated is that this rule, we want to input the language around the requirement for a PMIP. But there is a House Bill 25-1162, that is being implemented and needs to be implemented by December 31st of 2026. Another team in our department is implementing that bill, but part of that is changing the name of the PMIP form. And with all of the timelines and just how things go in HICPUF, they don't line up. So we are not explicitly naming that the form name in our regulation for this change, but rather just including some language around the requirement. And we'll dive into that specific language in just a second. So what I am thinking is I will take over the screen and we'll go through the rule as a whole. And I think Rachel will put the rule in the chat if you want to follow along. But we'll go through the rule as a whole, and I'll pause in between sections for questions so that we can get feedback specific to each section. I just don't think I'm going to pause in between like some of these just purely cleanup portions because they are very straightforward, which is a lot, the first few pages of this rule. So bear with me as I scroll. So 8.400, 8.401, just removing CHCVS. As I mentioned, that waiver has been merged into CWCHN. Oh, Eileen.
Sorry, don't want to interrupt. Is there a way you can make it just a little bit bigger?
Oh, yes.
Okay, perfect. Thanks.
Well, maybe that's a little too big. Okay. Is that good? Okay. Perfect. So let's see. So yeah, so just deleting CHCBS and then making some grammatical changes based off of deleting CHCBS. Very straightforward. So excuse the scrolling. And then here too in 8.7101.a, that is currently where the CHCBS waiver program lives. We are removing that, and it will just be left as intentionally omitted. Let's see here. Then same with 8.7200B, removing CHCBS. This was our first instance where children with life-limiting illness was not renamed when we did the regulation change last spring. So we're just renaming it to the Children with Complex Health Needs waiver. And then same with 38 in this section. And then 8.7203 is our first instance where the CDOS regulation citation was not updated. Again, it used to be 8.7514 and is now 8.7515. We're just changing, ensuring that aligns. Let's see here. And then CDOS, we're now in the CDOS section, and same thing, just renaming, renumbering to align with the existing numbering. And in 8.7515.m, we had one instance where we listed waiver and it should say CFC. It was just something that we missed. But it will be CFC only because CFC is now the only place that you can access personal care, homemaker, and health maintenance activities. All right. So here we have, I put in a little note because I just want to make it extremely clear with this 8.7522, 8.7524 renumbering system that if we are going to take this 8.7524, it is dependent on this House bill or this House bill on this MSB regulation, proposed regulation, MSB 25-10-22-A. It is expected to be effective prior to this rule. And if that doesn't happen, we will look at a new numbering system. I did see something, I wasn't able to fully read them, but I saw some things coming in the chat about not being able to use the -1. If that's the case, we will be renumbering this section, and we'll work with the Attorney General's office about what is appropriate to renumber it as without having to completely move it in our regulations, because that's ultimately what we don't want to do, is like put it up end. We like things to stay in somewhat of an alphabetical order. So we will work with the Attorney General's office on that. But let's see here. Scroll down to the first big change. All right. So here in 8.7524.g, we input the general language that we use for all other services about OHCDS. So extraordinary cleaning is authorized for organized healthcare delivery system, OHCDS. That one is pretty straightforward. Then we have an entirely new section, which is 8.7524.h, extraordinary cleaning reimbursement to family members. And we would love your feedback on this section. So we have number 1, family members / legally responsible persons may provide extraordinary cleaning and are subject to the conditions below. The family member / legally responsible person must be employed with a Medicaid enrolled provider who is eligible to provide the extraordinary cleaning service. The family member / legally responsible person shall be reimbursed at an hourly rate and may only provide services that meet the definition of extraordinary care as defined at 8.7502.II. C, extraordinary cleaning services furnished by a family member / legally responsible person shall exceed typical household cleaning or parental responsibility as defined at 8.7502.kk. 2, be necessary to ensure the health and safety of the member due to the member's disability. And 3, require specialized cleaning, infection control protocols, or commercial grade products or equipment consistent with 8.7522-1b, which I'm realizing we did not catch that 24, but it is the extraordinary cleaning section, and then 8.7522-1.c. And then the last part of this section is D. Payment to family member / legally responsible person must be prior authorized by a case management agency. Any extraordinary cleaning provided without prior authorization is not reimbursable. So I will scroll up to the beginning of this section and open it up for any questions, comments, concerns, and then we will move on to home delivered meals after this. Eileen, do you want to?
Sure.
Okay.
Okay, Jerica, go ahead.
Yeah, and I just apologize. I have a TBI, so sometimes I get caught in my words. But 2 questions. The first one was back to that the numbers point G. When it says if the rule passes or may not pass, it would could you explain it? Because it says in effect prior. And so I guess I'm just confused. And I know someone just put in the chat the August 14th, but my thing is in there, I'm not sure what it's saying. Is it saying that these aren't changing till the rule is passed, or like that rule language is not confirmed until the rule passes?
So I think what the confusion is the numbering. So the extraordinary cleaning and chirp habilitation currently share the same citation, which should not be the case, but they are both currently 8.7522. When we were looking at how to fix that, we were considering kind of doing this like Frankenstein numbering of 8.7522-1 so that they could stay in the same order, but not share the same citation. However, we noticed that there was another rule that's completely separate from this rule, MSB 25-10-22-A. We noticed that is supposed to be effective on July 1st of 2026. If it passes, it hasn't gone before MSB yet.
Okay.
So it's still up in the air, but we're thinking if that rule passes, we will take that section, that 8.7524, so that it's not empty. But if that rule doesn't pass or the timeline changes with that rule, we will pivot and figure out a new numbering system for extraordinary cleaning. We just kind of saw an opportunity to jump in there.
Elaborate.
But it just depends. So.
Okay. Yeah. And then my next question, and I'm just thinking like verbiage, right? So when it talks about reimbursement, is that because when we submit our hours as a legally responsible person, the PASA gets reimbursed? Is that what that's meaning? Because I'm thinking reimbursement is that someone's paying out of pocket and then you get reimbursed. But if we're as the person, is that because of like how the state works where they submit it and then the PASA gets reimbursed?
Yes, from my understanding, and Danny, correct me if I'm wrong, but this is saying that the reimbursement would still go to the PASA or the provider agency, and then the provider agency would reimburse the actual provider providing the service.
And just for plain language, do you feel it might be necessary to like kind of elaborate within that so it's not confusing? Because I know I feel like when extraordinary cleaning first came out, like it was more like medical grade cleaning supplies, and it made me seem like, do we order those and get reimbursed? All that to say is when I think of as a stakeholder, the reimburse, it's like, I don't feel like that's very clear, especially if we're really referring to a PASA being reimbursed.
Yeah, we can definitely take that back and look at further clarification for that.
Okay. And then, yeah, that's all.
Okay, great. Thank you so much.
Maddie, this is Danny. I can add some additional clarification too for
Thank you.
Jerica. So just wanting to clarify the purpose of extraordinary cleaning. So for extraordinary cleaning, the reimbursement is not intended for the actual products to complete the cleaning. It is to be reimbursed for the actual service of extraordinary cleaning. And so when we're talking about reimbursement to family members, this regulation is specifically saying family members can be reimbursed or they can be paid to provide extraordinary cleaning for the at an hourly rate, and so they're reimbursed for the service itself. They are not going to be reimbursed for supplies.
Right. And I think that was just the confusion when it first changed from the waiver to the CFC. I think there was just confusion on that product stuff. And so just why I have you also, because I feel like CMA maybe now has a better understanding of this service. When we do require that, how, and maybe this is a question for the CMA, but I'm just not sure how we include that in our service plan, because sometimes it's just unexpected. So I don't know if maybe you guys could let me know who would be the best person to explain how to include that. Oh wait, you know what? It's CFC. Well, does CFC is the same as like your waiver? Does it have to be in your service plan like you would a waiver?
I'm not sure if I'm entirely following your question, Jerica, but I'm gonna restate what I think you're asking. Are you asking, and maybe it'll help me if I better understand
Because
this.
it used to be
Are
on
you-
CS waiver, so it used to have to be in our service plan.
Yeah, so extraordinary cleaning still does need to be in the service plan and it needs to be prior authorized. So it's something that should be planned ahead and the case manager would need to authorize on the prior authorization or on the PAR. It is separate from CFC, but it would be authorized on the same.
Okay, so we just kind of bring that up during our like level of care review and the
Yep.
CSR stuff. Okay, awesome. Thank you. So I appreciate you guys. This is the first time I'm having an opportunity for clarification with this, so I appreciate it.
All good. No, these are good questions.
Thanks, Danny. All right, we'll go to Patricia next.
Hi, this is Patricia. My question is, it says, so they must be employed with a Medicaid enrolled provider. So is that forcing us out of CDAS then into the other one because we're going to have extraordinary cleaning? Because we can't have both. Is that kind
No. Sorry.
That's how it felt. That's what I was reading. I was like, wait a minute.
Yeah, no, that's a good point. And I meant to actually address this when I was talking about how extraordinary cleaning and homemaker are separate. So extraordinary cleaning and homemaker are separate. Homemaker is still through CDOS, IHSS, agency-based care, and that's under CFC. Extraordinary cleaning is only available under the SLS and CES waivers, and not connected to CFC, which is a little confusing. It's in our CFC cleanup regulation. But back last spring when we ran our regulations for CFC, we had to address the what used to be homemaker enhanced. And with homemaker moving under CFC, we then created extraordinary cleaning to kind of cover the extraordinary cleaning portions of homemaker enhanced. So that kind of became its own service, but was still sort of connected to the CFC project. So now in running the cleanup, they are separate services, extraordinary cleaning separate from CFC, but we're running it in the same cleanup because they were initially tied together and it just kind of flowed well for us. But yeah, so I understand how that's confusing, but it is not connected to CDOS.
Okay, thank you.
Yeah.
All right, Megan, go ahead.
Hi. Yeah. So my initial understanding with extraordinary cleaning is that it could be billed on a per unit, like per 15-minute time sort of unit piece, but that it alternately could be billed on a per dollar piece for bigger projects. And that's what we've run into is case managers are not understanding that or not understanding how they could possibly bill this on a per dollar basis. And just wondering if there's ways in the rules when you're already in it and have it open to clarify that to make sure people understand that it could be billed in either modality rather than having to be in 15-minute time increments. And I think a side question with that is, I assume that LRPs would have to bill it in 15-minute times, not in dollar amounts, but I think there's some gray area and lack of clarification in that because extraordinary cleaning could only be billed in time units previously, and this is sort of the adjacent to that service now.
Thanks, Megan. This is Danny from HICPUF. That's really good feedback, Megan, and I think we can look at the section specific about reimbursement just to make sure that that is clear that general reimbursement for extraordinary cleaning can be in either the 15-minute increments or the flat unit amount for larger projects. And then just clarifying that for family members or a legally responsible person, reimbursement does need to occur at an hourly rate and not necessarily project based. So hopefully that answers your question and confirms that we're looking at the other section.
Yes, sort of. I mean, I think in one of the early meetings, even somebody mentioned like this could pay for you to rent a industrial grade carpet cleaner to clean and disinfect carpets. And in that sense, maybe it would be the LRP who is being reimbursed on a dollar basis rather than a 15-minute basis. I think all the nuance of it is where we're getting stuck in how does it actually get implemented and look like.
Totally, that's a good point. And apologies, I'm not recalling the meeting where we said that it could be used to rent deep cleaning materials. So if you know where that is, I'd be happy for you to point me in that direction so I can re-review that section. But the intention really is,
but probably like a year ago.
okay.
It's been a while, so.
Okay, we'll take a look. And then just clarifying for the purpose of this meeting and just the rules and what we're trying to get to is extraordinary cleaning really is intended to be payment for the actual service itself. And so not necessarily for materials. While obviously, you know, it can pay for projects, it's not necessarily intended to pay for rentals or materials or supplies.
Got it. So it could pay me to pay a carpet, or it could pay a carpet cleaning company to professionally come in and clean the carpets, but you're saying now it would not be intended for me to rent a professional grade carpet cleaner and do it myself.
You could get paid for providing the service, but you wouldn't get paid for the carpet cleaner specifically.
Got it.
Thanks, Danny. We'll go to Lisa.
Hi, thank you. Hey, I was wondering if it could be considered on pretty much where your screen is 8.7524H1A. If you could please consider the responsible person must be employed with a Medicaid enrolled provider. If it could be considered to be employed or contracted with. Because currently it's allowed to be as independent contractors. And the only thing really that's required to be employed is HMA, but like personal care, homemaker basic, homemaker enhanced, they can all be done by contractors. There's just a huge cost for providers to employ all of the caregivers. And the reimbursement rates are not very high to consider that about having somebody they must be employed by.
Thank you. We'll take that feedback. We'll take your feedback back and see if there's a way that we can incorporate it.
Great. I know that that was the same verbiage when CFC first started, and you guys did consider that. So I appreciate personal care and homemaker can also be done by contract through agency based. So I appreciate that.
Okay, and then thanks, Lisa and Danny. ILC Colorado, go ahead.
Hello, I apologize. I feel like this was just answered, but there's a comment made that kind of made me question it. So to confirm, if a parent and legally responsible person is providing extraordinary care, they have to be paid an hourly rate, not the 15-minute unit rate. Is that correct?
The 15-minute, so the 15-minute unit rate is the rate that the provider claims. So that's what they bill to Medicaid. What this regulation is saying is that the provider needs to pay the family member or the legally responsible person an hourly rate to provide the service. So like, just like any other employee is paid an hourly rate, the provider is responsible for paying an hourly rate for the service.
Right. So for example, like our agency, we hire independent contractors. We train them. We're a Medicaid, we're a PASA. So when we pay a family member or a legally responsible person, we're paying, the 15-minute unit rate times 80% because they're a family member, which then will be paid at that hourly rate based on that 15-minute unit rate. Does that make sense?
Yeah.
Okay. And that's exactly what you're saying.
Yeah, we're just saying like
Super.
that it's not necessarily appropriate to do like overall project pay. Like we're not going to say that they get like a family member can't directly bill for a project and it must be paid out at an hourly rate. But how you decide to pay and your pay structure, that's up to you, like as a provider.
Okay, cool. I just wanted to make sure that it wasn't going to be two different authorizations then. So, versus a legally responsible person and a non. Okay, so that makes sense then. Thank you.
Mhm.
Okay, I'm not seeing any more hands up. I'll just double check the chat here, make sure. Is there any other extraordinary cleaning questions? I do see one from Victoria. I think that's the only outstanding one. So Victoria said, I was told I cannot chart for any cleaning that doesn't require hospital grade cleaning material, but some of that cleaning is things like vent/whole house fan cleaning. How do you do that? So Danny, if you have any thoughts on that, feel free to chime in.
Yeah, I think that sounds like a specific issue with a specific agency and not necessarily something that we can get into right now with the rules. But Victoria, if you want to connect offline, we can talk about your specific situation. I think I'll need more information before I can provide any answers.
That sounds good. Okay, with that, I'll go ahead and pass it back to Maddie if there's anything left rule related you want to go through.
Yes. And
We have 10 minutes just as a time check.
yeah, looking at the time, I will just go through this super fast, just so that when you are reviewing on your own, you're not caught up by it. There's kind of the bigger things. So home delivered meals, this looks like a really big change. It's not. We just moved this portion, which is essentially the eligibility portion for the service, from the exclusion section and moved it into the eligibility section. We tweaked a little bit of the wording like in B, but nothing major. So I just don't want anybody to read that and think we're changing the whole eligibility section. We're not, just reorganizing. And then that was just a revision for clarity. I'm going to scroll pretty fast, so my apologies. For IHSS, specifically, this is the language that we talked about, or that I previously talked about. For the members under 18, we just added this section that members under the age of 18 are not required to provide assigned physician attestation of member capacity and are required to have an authorized representative. That is pretty straightforward, but if you have any feedback about how we have that written, please email us or fill out that feedback form. This section, very similar to that home delivered meals. We're just kind of restructuring an already existing bullet, already existing language. Let's see, scrolling. And sorry. Okay, for transition setup coordination, we have created a definition for transition setup coordination to reflect what transition setup coordination and transition setup coordinators do. So we put transition setup coordination includes assistance with transition setup provided by a transition setup coordinator to assist individuals with the logistics of setting up a new residence, such as obtaining documentation required to sign a lease, completing a lease application, securing household items, setting up utilities. And then transition setup coordinators must be employed by a transition setup coordination provider agency that meets the requirements outlined in these sections listed. This is in the exclusions and limitations section for transition setup. Again, this is one that looks like a big change, but it's just a lot of restructuring. All of these exclusions currently exist. They're just kind of listed in a weird bullet point manner. So we're just restructuring it. The only two new ones that I want to call out is, in addition to cable satellite, we added streaming services, and then we also added gift cards. This transition setup not available for a transition to a living arrangement bullet point. This already exists here in 6. We're just moving it up as part of this restructuring. So feel free to provide feedback, but on the structure, whatnot, but just know that a lot of this regulation exists in rule, just moving. We've added transition setup coordination to specify that's what we're talking about when we say provider agency. So not changing the requirements for transition setup coordinator, we're just clarifying. And then we've added in for transition setup that there is no reimbursement is allowable for items that are donated or otherwise obtained free of charge. Then the wellness education benefit, we're removing CHCBS, and then for the children with life-limiting illness waiver, that should have been renamed the children with complex health needs waiver, but we missed that one in our change last year, so we're fixing that here. Here I just want to note, because it's a little bit confusing, is currently in this section 8.7556.f 2AI is currently blank, and instead of just having it blank, we're just adding in intentionally omitted, that we previously deleted that and tried to renumber it and it got missed. So we're leaving that there. And then for community first choice, again, this is the air quotes PMIP language. The PMIP form name is changing. So this is kind of the vague language that we're leaving in the meantime. So please feel free to provide any comments, questions, concerns about this language. And I think Rachel can put the rule link again in the chat and the feedback form, or you're also welcome to email us in addition to filling out the feedback form. Some people like to download a copy and mark it up, and that is also lovely. So please feel free to submit feedback in whatever way works best for you. And I will pass it back to Eileen.
Thank you so much, Maddie, for going through those. I see, Bree, you have your hand up. I'll go to you quickly, and then we'll just wrap up with the few last slides.
For sure. I don't want to take up too much of your time, and my apologies if this has already been answered. My internet went down a couple times throughout the call, but as far as like what the expectations are and kind of like what is allowed and isn't allowed under each service, is there something that's going to be put out by HCPF that can be ruled out like statewide? Because we're finding a lot of like confusion depending on like agency as to what is allowed and what isn't allowed. So definitely needing some sort of clarification, especially with all of the new CFC stuff being implemented. So just wondering, like, if you guys have that at all on your radar as something that can be rolled out on your end.
Thanks, Bree, for that feedback. It might be good to connect offline so we can get a better sense of what information you feel like is missing, and we can see if we have a resource for you already on our webpage. And if not, we can take back making one. So feel free to email us with some of your specific questions and we'll get in touch. Okay, so we have a few minutes left, so I will go through these slides quickly, these last few slides. So Maddie just went over our CFC rule cleanup. We wanted to give a brief overview of our emergency rules that passed last month that contain a few CFC related sustainability initiatives. So I'll kind of skip through this quickly, but essentially we have passed our emergency rules on the February 13th. Those have a few of the CFC related sustainability initiatives, including the soft caps for personal care, homemaker, and health maintenance activities, as well as a reduction of our legally responsible homemaker allowable hours from 10 to 5. Just as a reminder, these changes did not include the proposed 56-hour caregiver limit. That initiative has been paused, along with a couple other initiatives, the IRSS rate alignment and the Community Connector age 6 requirement. We're working still with our Joint Budget Committee and legislative partners, and we'll update you as soon as we have any additional information on those. But just so everyone is aware, these emergency rules will be made permanent, and the next rule hearing for those will be on April 10th with an effective date of May 30th. So if you do have any questions or feedback on the emergency rule changes specifically, you can utilize, Maddie, is it the same form that you are taking feedback, or is it a different form?
No, it's a different form.
Okay, it's a different form.
I think it's the sustainability form. Rachel, if you have the link open, that would be great.
Okay, perfect. So again, we'll always consider your feedback, so feel free to submit that through the form that will be posted here in a minute. And then just a reminder for any case managers who are on the call, I know I mentioned this earlier in the meeting, but if you have any operational questions specifically, the CMA office hours for sustainability initiatives is the best place to go, along with referencing your operational guide. The next two office hours are March 11th and March 25th. Those are just for case managers. But if you're a member or an advocate, and you have questions about the sustainability initiatives, you can still utilize the stakeholder comment form. Our strategic office manages that form and can connect you with the right SME to help answer your question. Alrighty, and then just as a reminder, we have moved to every other month for these meetings. So we'll be meeting again in May. There will be no April meeting. So we'll see you in a couple months. And then after June, we'll move to a quarterly basis as we'll have wrapped up our transition year for CFC. And we'll kind of move into just kind of more ongoing operations with the CFC program. And we don't anticipate needing to meet as frequently. Okay, so I know we ran out of time today and I apologize. There are a lot of resources in these slides, so please feel free to check those out once these slides are posted on our stakeholder website. You can always email us. Our HICPUF email is on these slides as well. And then we will see you next on May 6th from 10 to 11 a.m. So thanks, everyone. We appreciate your feedback today, and we'll see you in a couple months.